So VASCERN was set up with the aims of providing care for patients with unusual or rare diagnosis, specifically so that we could coordinate the care of patients with these rare conditions. One of the criteria for a rare disease to be part of this condition was that it should be rare enough and have multi-vessel involvement to be considered for to be in this cohort. So three main objectives were noted. One of them was the potential of developing collaborations between European centers and developing quite highly specialized healthcare for patients, and for this then to reinforce research as well as perhaps databasing with registries and training of other health professionals. Part of producing these talks for videos that can be available for education and training of clinical professionals came from one of these objectives. In addition to this, we also felt that pooling together expertise would also help in establishing best practice in all our centers as well. So all of this info is available on www.vascern.eu, and it involves all the conditions that are associated in this ERN. So vascular diseases were focused on, and as you can see, there are 5 categories there. The aorta falls under the HTAD group of diseases, and the medium-sized arterial group considers vascular EDS. We are possibly expanding this to include spontaneous coronary artery dissection and fibromuscular dysplasia as well. We haven't considered other conditions like kyphoscoliotic EDS or the classical EDSs, which can be involved, but that perhaps is for further discussion, or maybe they come under the category of reconnect, where the rare types of EDSs are already represented. So the structure for VASCERN was including 5 rare disease working groups, as I've mentioned already. There is the HTAD group and the medium-sized arterial group. In addition, there is a group for HHT, a group for vascular anomalies, as well as a group for lymphedema as well. So in addition to these rare disease groups, there's also the patient involvement in all of these rare disease groups as well. Unfortunately, our patient representatives from the VASCERN MSA working group were not present, are not present today, but we have invited other patient representatives from the UK for this meeting. The transversal working groups involved a patient registry, e-health and training and education, ethics working group, as well as a communication working group as well. So the members of the MSA working group who are all represented here today, there are 6 centers, and most of us participate in monthly meetings that we have, where we discuss what kind of consensus we want to reach and how we are going to write up those documents, as well as kind of consider additional topics that we might want to work on for the year, and discuss cases that we are finding quite difficult to solve within our own practice as well. So I'm just giving you this as an overview. Each of our monthly meetings actually has several work packages that we talk about. And I probably want to highlight this work package, which is what we are trying to do today, which is Pills of Knowledge. So producing short videos so that we can use that for education of not only patients as well as other clinicians is one of the key categories that we are working on. The other key category that we are keen to really establish soon is registries. The French group specifically have a well-established registry, Radico, and we probably will be hearing a little bit more about that later on today. How we can all participate in this well-established registry is something that we are looking into and hopefully will achieve very soon. In addition to that, we've talked about the some of the publications that we have already produced from this working group. One of them is the vascular EDS pathway. So we considered red flags for considering this diagnosis, what kind of multidisciplinary clinical evaluation we would recommend, and genetic testing and management and follow-up. I think as a lead on to this, we should probably say if this is negative, then what are the other conditions that we would consider, what panels specifically, and how we would consider management of those conditions as well. So the other thing that I think has been well received is the do's and don'ts fact sheets that we have established for vascular EDS in this working group, which gives a lot of information on pregnancy in vascular EDS, how to manage arterial complications, bowel complications, and exercise in individuals with this condition as well.